Tracking the monkeypox epidemic. Tonight we have mixed news. 316 new cases reported today. That is below average for a Tuesday as the outbreak shows signs of possibly slowing down.
But today officials in the Houston area confirmed the first death in a person who had monkeypox, as well as other serious illnesses. An autopsy is underway to determine his causes of death. That was the first death in a U.S. monkeypox patient and the 11th in this global epidemic.
Now, this strain doesn't kill many people, so let's take a closer look. What actually is the risk from monkeypox and who can get vaccinated? THV 11 Sarah Hobakowitz brings us answers from pharmacists here in Arkansas.
Talk of a new disease spreading and a new vaccine might feel reminiscent of early COVID days, but monkeypox is very different from COVID. For monkeypox, we already have a vaccine available and treatment for severe cases, but with a painful rash and flu-like symptoms, you should stay cautious.
You don't get it from just casual contact in the grocery store or anything. It is something that is a skin-to-skin contact.
Right now, one of the highest risk communities for monkeypox is among men who have sex with other men, but that's more by chance than biology.
Don't mistake that that's the only way that it is spread. It is not a sexually transmitted disease.
Even still, right now, that's a big part of the community getting their first vaccine doses.
Northwest Pharmacy is a very affirming and safe pharmacy for the LGBTQ community, so it only kind of made sense to make sure we use an affirming pharmacy that has a link to that community.
This month, who and where people can get vaccinated has expanded. A few dozen vaccine sites now open across the state for those at risk.
We have people coming in every day. We're actually nearing our 400th dose giving.
It takes 2 doses, 28 days apart, with full protection 2 weeks after that last dose. But if you get the virus, you're not out of options.
The treatment is actually a treatment for smallpox, because monkeypox and smallpox are close cousins of each other. So that helps protect you from getting a more severe case.
The treatment isn't available for everyone, and this is a serious illness. The rash can be severely painful, so bad some patients have to be hospitalized and put on the strongest opioids. It can last for weeks, also causing flu-like symptoms, so even with such a low fatality rate, people should still be careful.
Make sure we're washing our hands. If you feel like you've been in close contact with someone, wear a mask. Wipe down surfaces if you can, but it's really just common sense practices. Make sure you keep yourself safe.
Arkansas has only requested about half of the allocated vaccine doses. I reached out to the health department to ask why that is, but no one was available for comment tonight. The pharmacists I spoke to say they still have a good supply of the vaccine, but the shot is still only available in those few dozen pharmacies across the state.
Thanks, Sarah. You can find a map of places offering the vaccine through the Arkansas Department of Health's website, or they can help you find a clinic if you call their monkeypox response line.